Sit, Stay, Play is that warm, welcoming, calm, and silly presence here at Cook Children's. Cook Children's began their Sit, Stay, Play program back in January of 2014 with 2 facility dogs. At the time, there were only a handful of other programs across the country. Now, in 2022, we have 6 full-time facility dogs, and there are well over 20 different facility dog programs across the country. Our dogs are officially considered a part of the Cook Children's staff, and they work about a 40-hour week alongside their handler. Wherever their handler may go, the dog may go. The handler and the dog work seamlessly together as a team. Steve is my dog and the youngest of the group. He is the goofball who's known for his great energy and his ability to work the room, making sure that everyone that is there gets to spend some time with him. He is happiest when he's playing a game of fetch or when he's sitting in someone's lap, even though he's by far one of the largest dogs. Steve and I work all across the medical center, taking referrals both inpatient and outpatient at Cook Children's.
My name's Annie. I'm a child life specialist and mom to our fluffy golden doodle, Bree, also known as Brienne. Bree's personality is really the perfect mix of sweet and sassy. She is very lovable, loves to snuggle, climb up in bed with patients and families, and spend time with them in their rooms. She also, though, has a fun, playful, goofy side where she loves to run around the hall, play fetch, or go for walks with kids. When Bree is not working, you can usually find her up in the nurses' stations, snuggling with the nurses, getting lots of pets and love, or playing outside with her puppy friends.
The dog that I work with is in the care team, which is the child abuse program, and also the fostering health program, which is the foster care clinic here at the hospital. Kitty is just a love bug. Her favorite thing is to be rubbed on her tummy, and wherever you see her, you'll start petting her and she'll lay down, roll on her back for you to rub her tummy. And she does that with the kids, she does that with the parents, employees. She just loves to be loved.
I'm Valerie, and I'm a recreation therapist and also the handler for Zuni. Zuni is one of the newest dogs on the Sit, Stay, Play dog team. We have been a team since May of 2019 and have been here at Cook since September of 2020. Zuni is interesting and unique in the fact that she is the only dog that is part lab, so she's pretty easy to spot when walking in the hallways. In fact, people frequently will ask if she's gotten a haircut because they're used to seeing some of the other dogs with longer hair. Zuni is also a dog that gets very excited. She's very loving and affectionate, so she loves to give kisses, and she will wag her whole body sometimes, and she will also get what I call the helicopter tail, where it just goes in a circle. It's the cutest thing. Zuni also has 40+ commands that she has learned in her training, and we use a lot of those commands when we interact with kids. So we'll use speak, we'll use shake, high five, fist bump is a very popular one. A lot of the kids love that, but I'm not sure if they love it more or if Zuni loves it more.
Chanelle is our oldest dog, and she is the most laid-back and chill girl that you'll ever meet. She's been that way since we first got her. I used to joke that I don't think she was ever a puppy because she's very serious about her work. She wants to do the right thing, and you can see that in her expression sometimes, but she also knows when she's done the right thing, so you can see that in her expression. She'll help a child with a procedure, and then we get in the elevator and she has this giant dog smile like, "Did you see what I just did?"
When you bring a dog in who's so calm, it's like the children and their families just mirror the dog, and their stress and anxiety automatically comes down.
Having a dog has really changed the way that I'm a child life specialist. I've been a child life specialist for a long time and only worked with her for a short time, but I think she's made my job easier in some ways. I almost feel like I'm cheating. I think another way is it's just more fun to have a dog.
Hi, I'm Kara, and I'm one of the child life specialists, part of our Sit, Stay, Play program here at Cook Children's. I got to join Team Neely about a year ago. Neely is our 4-year-old golden retriever who has been working for 3 years. Neely is our sweet, sassy girl who loves to snuggle and play. She loves to check on patients all throughout the medical center for our referrals and also staff. One of the things that we get to do throughout the day is we get referrals and go to different floors, as well as be able to plan staff visits to do check-ins for them. We all know that there's so much that goes on here at the hospital, and Neely loves to bring a lot of joy and a lot of fun wherever she goes.
The Sit Stay Play program obviously has grown tremendously. I hope we are able to get more dogs and get them in different areas of the hospital, different high stress areas.
I think the dog program is going to be really fun to watch. I think we're going to continue to find new ways to use the dogs in the future. So I bet there's areas now that we couldn't even imagine that a dog could be helpful. I think it'll be fun to see kind of which direction the program goes.
Our dogs incur costs every day, but no family will ever receive a bill for this service. Our program is completely donor funded, so every single food bill, vet bill, toy bill for our dogs is completely supported by our generous donors. Even with 6 full-time dogs, the reality is we still are not able to keep up with how requested and how in demand our dogs are. If you are here currently with your child or teenager and you're thinking to yourself, wow, how do we get to meet one of these dogs? Here's a little bit more information about how our dog referral process works. Patients are usually 2 years old or older, free of any isolation precautions and pet allergies, having a difficult time coping with the hospital, have a treatment goal that a facility dog visit could assist in meeting, being treated for a chronic or life-altering diagnosis, and admitted for at least 2 days with no anticipation for discharge within the next 24 hours. Our specially trained facility dogs are available to take a limited number of inpatient and outpatient referrals. The best way to find out if a room visit is possible is to speak with the child life specialist on your unit where your child is staying. You may have a chance to see a facility dog in a playroom near you. Another great question to ask your child life specialist on your unit. Our hope is that we can continue this program for many years to come.